Hi, I'm Dr. Sood, and I'm a radiologist at SCP, and I'm a cardiothoracic and general radiologist by training.
Hello, I'm Andrea. I'm the lead MRI radiographer at SCP Radiology.
So generally when people are sent for a lumbar spine MRI, they've been having symptoms of back pain for usually an extended period of time that have not resolved in response to conservative management, and their doctors want us to make sure that there's no underlying structural abnormality that's contributing to their clinical symptoms. So we get a very good look at the structure of the spine. We're able to see the vertebral bodies as well as the intervertebral discs between them, and whether any disease of those structures is resulting on impingement of the nerve roots as they leave the spine to supply the lower legs. And we also get a look at the spinal cord and the surrounding soft tissue structures. So we're able to pick up different parts of the spine and the patient's anatomy that may be contributing to their back pain or their referred pain to the legs.
MRI stands for magnetic resonance imaging. With these type of scans, we use superconductive magnets and radio frequency signals to create images of the inside of a human's body. So for this reason, we screen the patients to ensure that no metal goes into the machine. It is important to inform the radiographer prior to making a booking for an MRI scan about these devices so that we can phone the medical technologist and make sure that your implanted device will be safe or not to enter the MRI machine.
So generally, we're able to confirm a diagnosis and find out a cause for a patient's back pain, whether that's related to degenerative spinal disease or whether they have an underlying tumor or evidence of infection. Those can be teased out on MRI, and subsequent to that, doctors can decide whether they're going to manage the patient conservatively or whether the patient may need surgical management for the underlying condition. And subsequent to that, it can also be used in follow-up to see if symptoms recur, whether there's a cause for that can be identified or whether any complications of intervention have occurred.
There are certain MRI examinations that require special preparation. This will be made clear to you once you make your booking. When arriving for an MRI scan, the radiographer will meet you and go through a MRI SAFE questionnaire and dress in a SCP MRI SAFE gown. It is important to note that MRI scans are safe for pregnant females over the first trimester. Depending on the type of scan you have, we will position and immobilize you as needed. Because of the loud noises of the MRI scan, we will make sure that you are fitted with earplugs as well as earphones to ensure that the noise of the machine doesn't injure your ears. We will also give you a panic button, which you can press at any time to let us know if there is anything that is bothering you. Once you are positioned, the radiographer will push you into the tunnel, step outside and conduct the rest of the scan from the outside. It is important to note that we will communicate with you from the outside via the earphones.